Hello, I'm Jawad, Executive Medical Director at East Lancs. Very briefly to mention about COVID, as of this morning, we had a total of 130 patients in the hospital. As you may have seen that the numbers of patients in hospital with COVID has been gradually increasing. Reassuringly, not all of these 130 patients have been admitted as a result of COVID. In fact, quite a few are incidental findings, which means that the patient had presented with some other complaint, and while as a policy of testing of every individual that gets admitted, some of them have come back showing COVID. What that means is that COVID thankfully will not be hopefully having a negative impact on their outcome. And importantly, that these patients are vaccinated. Hence the message that if you still haven't taken on the vaccination, please do so, because by being vaccinated, the impact of COVID, whether it's incidental or whether it is a direct consequence, will have less impact on your health. So do the right thing and get vaccinated. And as I've been mentioning previously, please do follow the principles of IPC, of hand hygiene, social distancing, as we are practicing and continue to practice that in the hospital. In regards to visiting, there are changes as of today. We are now allowing 2 visitors per patient to attend to their loved ones. These don't necessarily have to be the same individuals and can vary, but each ward has got its own criteria and policy. So please do check with the ward managers of what the practice are and the timings and all that. But 2 of the relatives, friends, whosoever which a patient agrees to can visit. This, however, doesn't stand for the urgent care and A&E. Here we still expect the patient to attend on their own, and that is down to the sheer number of patients which we are seeing in our urgent care and accident and emergency department. Like I have mentioned previously, please do attend to other ways of approaching healthcare, which is 111, your GP surgery, your pharmacies, before you embark on coming over to urgent care or accident and emergency. There are huge pressures in these departments, and as a consequence, we do have long waits. But our staff are doing everything to help improve the flow and look after these patients. Last week we had our NHS Staff Survey result published. At East Lancs we had a very good response of 58%, which means more than 5,200 of colleagues working in the organization took part in responding to the survey. And this is at the time where a lot of pressures on the services has been. So big thank you to all the individuals and colleagues who took the time to complete the survey. The key results showed that 65% of the staff would recommend the organization as a place to work. 69% would be happy with the standard of care that is provided and would recommend a friend or relative to be treated here. And 78% believe that the care of the patient and service user is the organization's top priority. Now, there are still things that we need to improve, and we work very closely with our colleagues and member of staff in bringing in the positive changes that is so important to deliver a high quality, safe, effective and personal care. Finally, just wanted to remind that this Saturday was the first day of Ramadan. Majority of the Muslim population observe this, and it is a time for self-reflection, self-evaluation and self-improvement. And all that leads to the self-discipline and the control that is so essential in on our lives. At East Lancs on the 7th of April, colleagues of all faiths and backgrounds are being invited to fast for a day, and that is just to share the experience of what fasting is and how it can help in, as I said, self-discipline and self-control. That's all the update from me for this week. I'll update with you regarding local or any regional changes that may come in the coming few days and weeks. Bye for now.